Hello, section 1 again. Here's your week 6 wrap up. This week we talked about Achilles tendinopathy and plantar heel pain. To start out with some shout outs, Sam, Keith, Shelly. So Sam, you did a very solid original post with some good critical analysis and super active on the discussion boards this week. So good job. Keith, good critical analysis as well. Nice self-reflection on your practice. And you responded to each and every team member this week, so very active on the boards as well. And Shelly, you had some good additional outside literature and some good self-reflection this week. So good job, guys. Keep it up. Okay, so talking about Achilles tendinopathy, I think it's good to realize that we are talking about mid-portion Achilles tendinopathy when we look at this evidence. Level 1 evidence, we have some eccentric training, originally described by Alfredson. And there's a question as to how much is needed. Stephen in 2014 just really recently compared the standard group of the Alfredson protocol, that would be a total of 180 reps per day, versus an as tolerated group. And the reps shown here is that the standard group did about 166 reps per day, and the group that was advised to just do as tolerated but try to get to that 180 did about 112 per day. And ultimately it showed no difference between the groups. So there is that out there that maybe we don't have to have them push through quite so much pain. But this is just one study, and we do have several others that validated the use of the Alfredson protocol. There was quite a bit of discussion about some instrument-assisted soft tissue mobilization. This is really some level 6 evidence. So there's some growing body, but it's of evidence, but it's all theoretical evidence. So as listed here, these are a lot were histological studies and not even in human models. So, and then some have been. We have to be careful when looking at systems such as this that are, device specific and that have potentially been endorsed, that have gotten some sponsorships from these sort of systems. So there are some conflicts of interest, not in all of the ones listed here, but there have been some. So always be aware when you're looking at those articles. And then just some other clinical pearls. Using the regional interdependence model, I've seen quite a bit of low back dysfunction and some active and passive hip extension issues in this group, and have gotten some good results treating that. And then also some neurodynamics. So make sure you're checking that in your patients. The two articles listed here are more anatomy, so theoretical level 6 studies on Achilles tendinopathy. But just check it out in your patients and see what you find. So plantar heel pain, we have some good evidence for the regional interdependent model of manual therapy that we read this week with Cleland. And then our Martin clinical practice guideline published in JOSPT. These are our grade A recommendations. So manual therapy, stretching, taping, orthotics, night splints. And then originally in that CPG, dry needling had gotten a recommendation of F. And then it didn't have this randomized controlled trial by Cochette that was published in JOSPT in there. And they had some good results using dry needling to the calf and even to the plantar surface of the foot, I believe. Again, neural dynamics, it's still actually level 6, so these are just case reports in Meyer and Al-Shami 2007. So make sure you're checking that on in this group as well. think I mentioned in the Achilles neural dynamics, particularly I found sural nerve in that group, and then tibial nerve in this group. And then we have some really hot off the press literature with prognosis with McClinton in 2015, and found that BMI and age were not prognostic factors as previously thought. But duration of symptoms more than 7 months was negatively associated with positive outcome. And then I wanted to throw a little bit in here about the differential diagnosis. So try not to get some tunnel vision on the foot necessarily, and think about lumbar referral radiculopathy, particularly maybe S1 or radiculopathy or radiculitis issues. Also, tibialis posterior dysfunction, we want to be ruling that out as well. Potentially some fat pad atrophy, and heel fat pad atrophy could mimic some of these symptoms, and then tarsal tunnel syndrome. So make sure we're able to know what to look for these conditions as well. All right, coming up next week, we have acute and chronic ankle inversion sprains, forefoot disorders, and postoperative management. As a reminder, your group project is due Monday of week 8, so that's April 27th at noon, and that's so that we all can have some time to discuss it during that week. And remember, there's light at the end of the tunnel, but try to focus on what you're getting in these last 2 weeks. These are some good topics to talk about, and then the group project, I think that we all get a lot out of looking at that. Okay, so I'll see you guys on the boards. Have a great week.